Good morning, we are Team 91, and our topic today is the impact of generative AI on different types of job in nursing discipline. And here is our group mate for this project. In this video, we'll give the introduction, the type of job in nursing, the impacts of AI on them, and the use of generative AI tools, the reflection, challenge, and finding of them. And finally, is the conclusion. Let's start with the introduction. Our team has 5 members, and all of us are the students in the Bachelor of Science in Nursing program. And the purpose of this video is to discuss the positive and negative impacts of AI on different jobs of nurse and to explain the difficulty, reflection, and finding when using AI. And here are the job of nurse. First, we will talk about the nursing practitioner, who train beyond the requirements of registered nurse, and they will provide the comprehensive care to the patient. Moreover, they are the primary care provider who will work collaboratively with doctor, and they have many things to do. For example, provide physical exam to the patient, give them the diagnosis and treatment they need, and so on and so forth. What is the possible impact of AI on this job? First, AI can help the nurse practitioner to improve their medical knowledge because they can ask AI to provide the later medical knowledge and resources to them. And also, when they have something that makes them feel confused, they can ask AI to explain it to help them understand. And second, AI can assist the nurse to generate different material like video, picture, and report based on the patient data, and it can help nurse to explain the medical condition, the treatment, and the instruction of using medicine to the patient. For the negative impacts of AI, the nurse need to input a lot of data to allow the AI model to provide the recommendation or response. If the data input is mistaken, it will cause the bias or inaccurate in the output information of the AI, and the result can be very accurate. Therefore, they need to check this information and data carefully, and it will take a lot of time and will increase the workload of a nursing practitioner. And second, uh, if the nurse is used to using AI, they will develop a reliance on AI, and it will cause them to lose the critical thinking. But you know that the critical thinking is very important for a nurse practitioner. And here is the generative AI we use. We use the pickaxe to generate those free video. This is a generative video. And this is the palm. And this is original image.
I would like to introduce the second job, which is informative nurse specialist. This job also has a high probability of being replaced or affected by AI. Nurse informative is responsible for designing, applying, and managing technology to improve medical service. It combines computer science and information with nursing to enhance the patient's outcome and care. For positive impacts, AI can provide decision support. For example, when a patient has a complex medical condition, it can be difficult for medical staff to choose which type of the medical support should be given to the patient. In this situation, AI can provide decision support to the nurse to improve their service. The second point is that AI can improve remote patient monitoring. It can enhance patient care, increase the efficiency, and enable early intervention. Lastly, AI can reduce the time of the documentation of care process. For the negative impact could be data privacy and data safety. If AI does not have a strong network security system, it means that the patient's personal information is at risk of being leaked at any time. This can cause further harm to the patient. And this is the use of generative AI tubes and the detail value for each picture.
So let's talk about school nurse. School nurse connect healthcare and education, ensuring students' health and readiness to learn. They administer medication, conduct health scanning, and provide health education, empowering students to make informed health decisions. So the first positive impact of AI is they provide personalized care plans. With the help of AI, we can now create care plans that are tailored to each student's unique health data. That means every student can get a care plan which is specifically designed for their individual needs, ensuring that they receive the best possible care. Secondly, AI greatly contributes to administrative efficiency. For instance, AI can assist with tasks such as note-taking and content summarization. This not only ensure complete medical records, but also allowed school nurses to spend more time on patient care.
So then let's talk about the negative impacts of AI. Firstly, one of the negative impact is lack of emotional support. Although AI has many capability, it still lacks the ability to provide the emotional support that a human nurse can offer. School nurses often provide comfort to students who are feeling unwell, and a human touch that AI currently cannot replicate. Secondly, we have to consider the ethical consideration. There are some concern about the privacy and confidentiality of student health data when using AI system. So ensuring the protection of sensitive information is necessary. Lastly, there is the risk of inaccurate diagnosis. While AI has made significant strides in medical diagnosis, it may not be able to accurately diagnose all health issues, particularly complex cases. The human intuition and experience of a trained nurse are still invaluable in these situations. So, we have used two kinds of generative AI tools, including Canva and Playground AI. So, Magic Grab and Magic Edit and Magic Expand is used in Canva. And we have used Playground AI to generate 4 pictures. Let's talk about the challenges of doing this homework. So first of all, we cannot generate the correct pictures that meet our expectation when we type some complex prompts. So I have to keep correcting my prompts in order to generate a picture which look closer to what I want. Even I fine tune my prompt, AI still cannot generate a satisfying picture. So this is a concern. And secondly, generative AI may produce images that are distorted and impossible. For example, in this picture, the hand of this kid is weird and cannot be seen in a real world.
Let's move on to the reflections. In this project, we have learned to incorporate the deserted contents and details from the prompt, and this is our examples. Besides, we have uncovered the potentials of AI tools such as Canva and Playground AI, creating the expected image and dynamism to the photos. This can enhance the aesthetic appeal of the assessments, a skill that can be further utilized in the future tasks. With this AI tool, static image are transformed into dynamic visual that can captivate the audience. Also, we have learned to use Picker Lab, an innovative tool that allows us to create videos or animations by simply typing tasks. It has made video creation accessible and straightforward without any video editing skills. This is the examples of the prompts and AI response. We find that prompting to AI tools needs to be detailed and specific to reach the expected work. To conclude, generative AI have both advantage and disadvantage for the job of nurse. We have used AI tools in different aspects to improve the efficiency, including ChatGPT, Playground AI, Canva, and Picker. Although AI are useful tools, sometimes it is difficult to generate the correct photo of image. Therefore, adjust the prompting is important for us to have a expected work. That's the end of our video. Thank you.